Welcome back to the Doc Talk podcast. I'm Dr. Shazma Mithani.
And I'm Dr. Sheila Wijayasinghe. So today we're talking about a really important topic about health misinformation online. But first, a word from our sponsor.
We want to take a moment to thank Figs, our season sponsor. And honestly, this one is such an easy one for us because Figs is actually what we wear to work. Their scrubs are comfortable, flattering, and genuinely cute. We get compliments on them all the time, not only from patients, but from colleagues as well. They're incredibly practical. The pockets actually fit everything you need, like phones, notes, pens, everything. And I'm always cold. So on colder days, the hospital hallways are cold too. And so the layers really help keep you warm. The compression socks are another staple. I'm on my feet all the time. And so they're supportive enough for long shifts, but still really cute. Same with their hair accessories, headbands, claw clips, and scrunchies that actually stay in place on busy days.
And Shaz, their work bags are so beautiful and thoughtfully designed with multiple compartments to hold everything from, my stethoscope and gear to power-up snacks and a change of clothes. And if you don't work in healthcare, the Figs loungewear set is incredible. Thick, soft, and high quality. I got my partner a set and he lives in it. If you work in healthcare or you're shopping for someone else who does, Figs just makes sense. Go to wearfigs.com and use code FIGSDocTalk. That's FIGSDOCTALK to get 20% off your first order. That's wearfigs.com, code FIGSDocTalk.
Okay, so let's get right into it. I've actually been thinking about the topic of health misinformation a lot lately. It's certainly something, if you follow my kind of separate content, you know that I'm always in the misinformation space trying to put some accurate health information out there. And that's big reason why we do this podcast too. In the ER in particular, I'm seeing more and more patients come in after trying something they saw online, and it's not always harmless.
Shaz, the same thing for me in family practice. It's like so many of the visits are starting with, Dr. Sheila, I saw this on TikTok and ChatGPT told me that I should do this. And while I appreciate that my patients are actually telling me these things, because I know a lot of the time that's not being shared with healthcare providers, it really does extend our visits. There's a lot of sort of going back and forth around misinformation, what's real and what's not. And it's really confusing.
Yeah. And I think, again, we've talked about this before. I don't blame the patients in this because it makes sense. People are just looking for answers.
And that's why we want to do this episode, because, we understand that there's a lot of confusing information out there and we want to distill it down for you. There was a recent Canadian Medical Association survey of over 5,000 Canadians looking at health misinformation. Almost 9 in 10 people in Canada now go online for health advice. And we had an opportunity to talk about this actually recently in Ottawa. Shaz, you and I were invited to go to the meeting where they announced this survey. And it was really interesting to hear about how many Canadians are going online and also how confused they may be. And the information that they're getting isn't always high quality.
Yeah, that 9 in 10 stat really stood out to me, that's how many people are going online for health advice. And then those people are also following health advice from AI tools, or those that are following health advice from AI tools are 5 times more likely to report harm related to that information that they got compared to people that don't.
5 times.
Yeah.
It's a big number.
It is. And it's not... I was actually particularly shocked by that number, to be totally honest with you.
Same.
I didn't think it would be that high. And I remember you and I were sitting next to each other. We looked at each other. We're like, what? Because that was, the first time that we were seeing the data as well. And that is harm that's being caused by this.
Yeah, and I actually spoke to the study, to the survey folks at Abacus, because I wanted to just kind of clarify that point. And they're like, no, this is what the numbers showed us, 5 times harm. Mm-hmm. And so 5 times more likely to be harmed compared to those who aren't using it. So that was really an interesting point. And again, I'm seeing that in my own practice. I'm sure you're seeing it in the Emerge, Shaz, that people are harmed in ways in terms of delayed diagnosis and otherwise. What's interesting also that they shared with us that day was that at the same time as people going online, 85% of Canadians are saying that physicians are their most trusted source still of health information.
Which honestly is, as a physician in this space, it was really nice to hear there is still a high trust index. But the big problem that you and I, of course, have talked about before as well, is that there are millions of Canadians that can't access a physician. So the most recent numbers show that over 6 million Canadians don't have access to a primary care provider. And so, of course, people are going to go online to look for information.
And so we're motivated to do this episode because of the CMA, the Canadian Medical Association survey, but we also were sent a great listener question in regards to this as well. So let's take a listen.
Hey docs, I don't have a family doctor. I go online for health advice because I don't know where else to go. How do I know who to trust? Thanks and love the show.
So this is a great question. So this is what we're going to address today, right, Shaz? Is like we're going to go through what the myths that we're
Mm-hmm.
actually hearing from patients, what the real medicine is, and then we're going to give you, our listeners, practical tools on how to navigate online spaces safely so you can know who to trust and who to unfollow.
Yes. So let's start with myth number one. Vaginal steaming balances hormones. So
Ugh.
I know the vaginal
Sorry.
steaming, this one keeps resurfacing. Like I keep waiting for it to go away and it just keeps coming back. And it's marketed as this like hormone balancing, fertility boosting, like urine detox, like all these kind of pseudoscience-y buzzwords, but it keeps coming back.
So the truth is, the vagina is a self-cleaning oven. It maintains its own microbiome. It maintains its own pH. You don't need to steam your vagina. It's actually a very misogynistic way of seeing the world and women's health, to understand that we need to clean the area constantly to feel okay and to feel healthy. There's no credible evidence that steaming balances hormones, improves fertility, or detoxifies the uterus. Hormones are regulated through your brain ovary signaling. Steam does not alter these pathways.
Yeah, and like the other thing to think about is just the local potential harm here. Like there can very easily be significant burns on very delicate tissues. There's pain, infection risk, a potential long recovery. So it's not just harmless self-care, it actually can cause injury.
So skip steaming your vagina. The vagina is a self-cleaning oven.
Mm-hmm. Okay, so this one is one that, again, keeps coming up over and over again, and that is that there is a natural cure for cancer that's being hidden. This one is heavy, but it's a recurrent theme that like just keeps coming up, that doctors and like Western medicine are hiding the cure for cancers so that we can keep making money.
And you know, this one really hurts, I think, Shaz, so much of our patients, because you're incredibly vulnerable if you yourself are going through cancer treatment, you've recently had a diagnosis, or someone you love has had this diagnosis. It's a life-altering event. And then when you hear online people saying, well, if you just do this, you can be cured, it can be very harmful. It is very harmful. We've both seen this in our practices. You know, we go into medicine to be able to support our patients, to give them the best form of medicine possible based on the evidence that we know that works. And we avoid doing harm by suggesting things that don't have great evidence. And treatment decisions for cancer are complex decision pathways, because it's really based not only on do you have cancer or not, but it's based on things like your stage, your tumor biology, the genetic markers, your own personal history. And that can be in the form of surgery, chemotherapy, immunotherapy, radiation, that are really carefully curated based on your individual profile. And so there's no universal natural cancer cure, which is often what's being sold to patients, and why patients will sometimes stop taking these evidence-based medicines in order to try these cures that are sold online.
And unfortunately, you and I have both seen patients delay treatment because they were told chemo is a poison, that supplements would cure them. I mean, have you watched Apple Cider Vinegar? That Netflix show, like that based on reality Netflix show? I mean, this is something that is just really illustrates things that you and I see all the time. And so it's really turning into a much more common presentation where instead of chemotherapy regimens, radiation, surgery that we know have evidence that will have a significant impact on cancer and mortality, instead people are following wellness influencers and wellness grifters, juicing, taking supplements, and then they actually end up coming in later, sicker, and sometimes with like widespread disease that could have been treated and potentially cured because it could have been like treated a lot earlier if they had just come in right away.
We did a little bit of a call out to our listeners to say, like, what have you seen in this space? And this one was actually a big one that people shared about. So some people shared about how coffee enemas are touted as a cure for cancer, which we know they are not. They have potential harm. They do not cure cancer. Another one that came up was actually from an RN follower, so a nurse follower who worked in a cancer unit. And she said that people were putting these apple cider vinegar types of things into their PICC line, so into their IV lines at home.
Yeah.
And that caused harm and damage to their patients. And so they shared these very real stories of harm that are being done. And so, you know, I think it's really important. Like, hope matters in medicine, but misinformation is harmful.
Absolutely. Okay, so let's move on to another myth. More vitamin D is always better. We live in Canada, right? There's a lot of talk about vitamin D. But Sheila, I think I want listeners to hear the story, that 20,000 international unit story that you told me. Can you share?
Okay, so I've had permission from my patient to share this story. A patient of mine came in and she goes, I have been taking a lot of vitamin D because somebody online suggested that it would be good for me, especially because we live in Canada. And I said, well, how much are you taking? And she said 20,000 units a day, international units a day. And that is an exorbitant amount of vitamin D, right? Shaz, like normally vitamin D is helpful, but most adults need about 600 to 800 international units a day, sometimes 1,000. The safe upper limit is about 4,000 international units a day. It was very surprising to me to hear this. And we went back and forth. And she said, you know, Dr. Sheila, it's because he has 8 million followers on his social media channels. So I trust him. And so we went back and forth. We talked about it. And the key thing here is that I said, we have to check your kidney function because high levels of vitamin D can be toxic to your kidney function. It can land you in hospital. It can land you in the dialysis unit. And so we checked her kidney function. It was starting to be affected by the vitamin D levels that were super high. And so it was a really big lesson for me to understand, like I need to ask about over-the-counter medications all the time to make sure and ask about dosing, but for her as well, because she said, you know, I trusted, and we went back and forth. Again, it's not her fault that she was misled in this situation. It is the error, and the real responsibility lies with that influencer who was giving misinformation that is very harmful.
Yeah. And I think they're like, I want to take a pause. We're going to come back to this as well. But like that follower count thing is something that comes up a lot, right? So follower count does not equal credibility. I can't tell you the number of people that I have seen harmed, not only like in my clinical space, but like people who are messaging me on Instagram or on TikTok saying like, hey, I'm going to do this because this influencer that has millions or hundreds of thousands of followers said it was a good idea. But like those two things do not compute. Like follower count does not equal credibility. And I think that's a really important point to highlight here.
Absolutely. So be careful with even over-the-counter supplements. You need to take appropriate doses. We can guide you through that. Your pharmacist can also help you as well.
Okay, so let's move on to our next myth, which is that vaccines cause infertility. And so we are continuing to see so much ongoing misinformation and disinformation around vaccines, whether it's infertility, the continuing decades later autism myth, the turbo cancer myth with the COVID vaccine. These things continue to circulate and do cause harm. I mean, a perfect example of this is how we saw in, you know, the province that I'm in Alberta, higher rates of influenza and higher rates of hospitalization of influenza, because not only does it affect like the MMR vaccine, where we also saw a measles outbreak in Alberta, and that's what caused us to lose our measles eradication status in Canada, but also it applies to vaccines in general now, that people are more hesitant, and that's leading to lower vaccine rates and harm related to that.
Yeah, and when we think about fertility and miscarriage rates, which is what is being shared online, you know, the evidence speaks volumes here. Large population studies have shown no impact on fertility or miscarriage rates. But these are very catchy phrases that are done, especially for vulnerable topics like fertility and pregnancy. And so this is where people get you with that kind of commentary that is wrong.
Yeah. And I mean, this is another example of people just not really knowing who to believe. And again, I don't blame the patients here, right? Because it's like there's so much noise out there of, you know, influencer X, Y, or Z, or someone who maybe has some credentials, but isn't maybe like necessarily credentialed in the thing that they're talking about. And so it's really, really a confusing space.
You know, at the CMA event that we were at, Shaz, you know, misinformation was described as an epidemic. And I think that's a very good description. And it really does require, this misinformation requires preparedness, early detection, and response, which is what we're trying to do. And I think that's a really important framing so that we can address this directly, to starting with you, our listeners, like share something like this, share our episode, fight back against misinformation, because the impact is going to just grow unless we stand up and fight against it. So let's go on to our next myth, Shaz, that I see a lot in family practice when it comes to chronic diseases. So things like, you can reverse diabetes and high cholesterol. So just stop your medications, because we can give you a little apple cider vinegar, or we can give you something else to do that. So stop your medication, stop your statin medication for your cholesterol. And yes, lifestyle absolutely matters for these chronic diseases like diabetes and heart disease and cholesterol management. But diabetes and cardiovascular disease or heart disease are complex and often progressive without appropriate treatment.
Yeah. And I mean, like like you said, lifestyle absolutely does matter. But we also know that medications reduce heart attack, stroke, and kidney failure risk. And certainly like the people that I see come into the ER with the kind of acute results of these things, like coming in with a heart attack or a stroke or a diabetic emergency, it's often because they have either not been able to afford their medications or intentionally stopped them abruptly because of something that they heard. And so that can mean things like DKA, stroke, heart attack, and we see those consequences every day.
So stay on your medications. If medications are something that you are struggling to take, or cost is an issue, or you're not sure if you want to continue on it, always do have a discussion with your healthcare provider to see if we can reduce the dose or just monitor you more closely or find solutions together that don't have you stopping them abruptly. Okay, the next one is one of my favorite, Shaz, because as someone who prescribes hormones, works in the menopause, perimenopause space, this one is a big one. So hormones are either dangerous and should never be prescribed, or hormones are the cure for every single symptom that you're having, because the pendulum is swung both ways. And this is a really big one that I see personally. I'm sure you're seeing it as well.
Mm-hmm.
And this keeps coming up and up. And what's really important to recognize is that when we talk about perimenopause and menopause, your therapy is going to be individualized. And for many healthy individuals, those under age 60 or within 10 years of going through menopause, hormone therapy has very good benefit that outweigh the risks. But this is a personalized discussion.
And I think that point is really important because medicine is nuanced, right? Risk depends on the timing, your age, your personal history, the route of delivery, all these things where it's important to have like a one-on-one conversation with your health professional because of that nuance that, of course, is not really easy to convey on the internet. It tends to flatten that nuance.
Okay, so let's talk about another favorite one, because we talk about expensive urine all the time, Shaz, where here's a big myth of detoxes clean your body. And you know what, guys? Thankfully, we have organs that do that work for us. Your kidneys and your liver are constantly detoxifying your body, and you don't have to pay anything for them.
And beyond just the expensive part of taking supplements because it's going to fix X, Y, or Z, really, and we've talked about this, the expensive P thing. These detoxes are also expensive, but they're not harmless. So like these commercial detoxes that are like juices or teas, they can often actually cause significant fluid loss. They're not going to cause toxin removal. In fact, what they're going to do is remove water and electrolytes, which are things that your body needs. They're often tied with like this extreme dieting, because like these juice diets, so to speak, are like drinking only these special juices that are super expensive, not having any solid food. And so that can actually like lead to significant issues with electrolyte imbalances, bone loss, eating disorders over the long term as well. And so these are not just benign things.
I'm seeing that a lot with our kids in our practice. So teenagers who are seeing this on TikTok or on social media channels, it's really interesting to see the impact of detoxes specifically and how they're being sold and marketed to kids. And so that's a really important thing to consider if you have little ones at home, to be aware of this kind of messaging that's happening and have those conversations early. So Shaz, to wrap up, we're going to do a quick myth roundup before we get to sort of how you can choose who you're following and who to trust online. So let's do a quick roundup of this episode.
Okay, I'll go first. Mouth taping for sleep.
Limited evidence. If someone has undiagnosed sleep apnea or nasal obstruction, it actually can be risky as well. So it's not a cure-all. Okay, Shaz, grounding sheets.
So this one I have to laugh at, but the theory here is that they reduce inflammation by connecting you electrically to the earth. There is absolutely no high quality evidence showing any meaningful clinical benefit here. Okay, how about castor oil packs, or like the oil kind of oil drawing, where you like take this like a pack full of oil and like stick it on your belly button?
I see people putting it in their mouth and their rectum as well for oil drawing. So like any of those things with oil packs that help draw out the toxins, there is no strong evidence that they detox the liver or balance hormones. You know, generally low risk on intact skin, but think about like if you're putting it in the rectum or in your mouth or otherwise, it can be harmful potentially, and it's not a substitute for medical care.
No, and like frankly, they just won't work. None of these are magic. No, it's just, you know,
magic.
all the boring things are the things that are actually going to have an impact on our overall health.
Fiber, protein,
yes,
movement.
Exactly. Okay, so, you know, a big reason that we wanted to do this episode is because Sheila and I feel really strongly that misinformation and disinformation are a public health issue. And the truth of the matter is that CMA survey that we talked about, it showed that 77% of Canadians are concerned about the rise of false health information, including false health information coming from outside of Canada.
And 87% of people believe that social media platforms should prevent false health information from spreading. And 90% of those who were surveyed think that the government should address it. And I thought that was a really interesting point because it does show that this is not just about the individual. It goes back again, Chaz, like you and I do not blame our patients for hearing these things and believing some of these things, because we need protection in place against this false information. It's a systemic issue. And when false claims shape beliefs, they help to shape behavior. And this is a public health crisis that's happening and unfolding right now in front of us that we need to act on.
And we see this, right? When these behavior shifts happen at scale, we see lower vaccine uptake, preventable outbreaks, delayed cancer diagnoses, harmful self-treatment, wasted healthcare resources from complications, and then this ongoing erosion of trust, and of course, the widening of inequities. We know that communities already, whether we take misinformation in or out, communities with less access are much more vulnerable to having health inequities, and then to this persuasive misinformation on top of that too.
Absolutely. So let's go back to our listener question. So how do you know who to trust?
So let's start by talking about the red flags. So anyone that's going to mention any sort of a miracle cure, or, this one thing is going to fix all of your problems, or this, that's like an immediate red flag. Any sort of fear-based messaging, anything that says that, doctors are hiding the cure, that's again, trying to instill this mistrust and fear. Anything that's an absolute guarantee, always check to see if they are selling the product that they're promoting, because that is an immediate conflict of interest. It's going to introduce bias and should really make you question, of course they want to make money off of this because they're selling it. And then if you can't find any, if you see something, you're scrolling by it, and then you can't see any additional credible sources outside of social media, then you should really question that information.
And then that brings us to what the green flags are, because there are really great, reputable folks out there who are trying to do a good job of sharing evidence-based information with you. So these green flags are things like they're going to cite peer-reviewed research. So not just a quick observational study or a case study saying that this one person had this experience, so this applies to everybody in the population. Peer-reviewed research are large-scale studies that really help us understand what the evidence is to be able to give you the best options possible. It's also important to know that, are they being transparent about their financial interests? So if they are sponsored, or if they are, if they give talks and they are paid by different companies, it's important for them to be transparent. We have very strict rules about this in medicine. We always have to disclose any financial relationships. And if they're not doing that, that is a red flag. So if they are being transparent, that's a green flag. If they acknowledge uncertainty, like you said, Chaz, when they're super certain about how something will cure something and they don't take any criticism, they're not able to share why they're saying what they're saying, and it's all in extremes, that is not what medicine is. Medicine has a lot of uncertainty to it. And if they're able to acknowledge that there is uncertainty in this space, that also actually gives you a moment to say, actually, that gives me more trust in what they're saying, because they acknowledge that this is what life is. This is what medicine is. If they encourage shared decision-making and trust building with your healthcare provider, I think that is a green flag. All too often right now, the way that these influencers who are misinforming the public are gaining favor is that they are building distrust with us as their healthcare provider to say, don't listen to your doctor, they're hiding something from you, like you said. So if they're saying, talk to your doctor, here's your right, here's how you advocate for yourself, those are really great green flags. And finally, they're not promising miracles. So again, it's that nuanced care. They recognize that everybody is unique, and they're not promising a one-stop cure. That's a green flag as well.
And of course, as I mentioned earlier, don't be fooled by follower count, because this does not equal credibility.
And if you don't have a family doctor, one of the challenges that we understand and recognize here very, very closely to our hearts that we recognize as a difficult thing of not having a family doctor or someone that you can trust, go to your provincial health sites, or in your different provinces, you'll have a connecting site to help you find a family doctor, a nurse practitioner, and academic hospitals can also help you out as well.
So, of course, this episode was motivated by that CMA survey that we talked about during the episode, and by a listener question asking a very real question that we actually hear from a lot of people. This was not an isolated question. It's certainly a question that I get a lot, not only in my practice, but in kind of the social media space as well. We understand why people are online, because we often need to find a source of information. Health is scary, and we often want just quick reassurances and easy answers. And so I absolutely understand why people are online when access is particularly hard right now.
But always remember that when you're following somebody, overconfidence doesn't mean that they're correct. And misinformation just isn't just annoying to us. It actually can change outcomes and be quite dangerous. So you have the ability to advocate for yourself, know what's real, trust your instinct, and always seek out support and ask questions of your healthcare provider if you're not sure, because that's what we're here for.
And, keep continuing to ask these questions, stay skeptical, and keep sending us your questions too. We love hearing from you, and then it helps us know exactly what you want to hear about.
So thank you to everyone for tuning in today to the Doc Talk. A reminder that the Doc Talk is for general information purposes only. This podcast is not intended to replace medical advice from your doctor. While we are doctors, we are not your doctor. Always speak to your own healthcare provider for questions related to your own health needs.
And make sure to follow us on social media at the Doc Talk Pod. And of course, be sure to like, subscribe, and review us wherever you get your podcasts.